They've bbeen called the silent drivers of behavior and personality. Their molecular fingerprints are on everything from attraction to appetite. Hormones. As we enter our 30s and 40s, our natural hormone levels decrease, potentially leading to weight gain, sleep disorders, and sexual dysfunction, among others. Many of these age-related symptoms are now understood to be caused by easily detected hormone imbalances.
Both men and women, as they get older, begin to lose hormones. Men start losing in their 30s, women in their 20s. Testosterone is the first hormone to go, and when you start losing testosterone, you become more anxious, more irritable, more depressed, gain weight across the midsection, less energy, don't sleep well at night. Women lose their sex drive, guys lose their sexual function. Their performance is not as good. So overall, people just don't do as well if they don't balance their hormones.
While hormone replacement therapy is not new to the medical lexicon, the types and delivery methods are ever evolving.
Basically, there are two types of replacement therapies for hormones: synthetic hormones and bioidentical. Synthetic hormones are chemically altered hormones that are created in a lab. Bioidentical hormones are just that. They're identical to the hormones we make in our body. They're plant-based, typically soy or yam-based, so they work really well in our body because our body recognizes it as natural hormone.
Synthetics come with a whole host of side effects: blood clots, heart attacks, stroke, and breast cancer in women. In men, synthetic hormones have to be converted in the liver. They also have a host of side effects. Bioidentical hormones are just like the ovary and testicle made your whole life. Less side effects, less complications, better results.
Many physicians and their patients are finding that hormone pellet therapy is most effective in providing the benefits of hormone therapy without the roller coaster effect of topicals, injections, or oral modalities.
Well, pellet therapy is using bioidentical hormones in pellet form. Those are compressed hormones. We take 54,000 pounds of pressure, compress a powder that's pure estradiol or pure testosterone into a very small pellet that's the size of a grain of rice. We then place it painlessly back here in the hip, just under the skin. It doesn't hurt going in. You're getting a bioidentical hormone that's there when you need it. So it's not in oil, it's not time released, it's all there as you need it, and it'll last you for 4 to 5 months.
Hormone pellet therapy is so effective because the dosing is highly individualized. It's dosed on parameters of the patient's age, weight, blood levels. There's several things we look at for the dosing. And moreover, once we place that pellet under the skin and your levels get to where they need to be, they last about 4 to 5 months. And so it's highly beneficial for the long-term standpoint for most of our patients.
Pellets are inserted painlessly into the hip, and it's subcutaneous, meaning it goes into the fatty tissue of your hip. Pellets are then placed into a trocar and placed into your hip. There is a small incision, small wound, doesn't require a stitch or anything. It then is released into your body by cardio output. So the faster your heart beats, the more hormone you're going to absorb. It is not like a time release hormone.
After pellets are inserted, patients will notice that they have more energy, sleep better, and feel happier. Muscle mass and bone density will increase while fatty tissue decreases. Patients will also notice increased strength, coordination, and physical performance. They may even see an improvement in skin tone and hair texture, and concentration and memory will improve, as will overall physical and sexual health.
Prior to the hormone therapy, I weighed 300 pounds. I was extremely sedentary. I didn't want to do anything. I had insomnia, had mood swings. After the hormone therapy, after 3.5 years, I've been able to keep the weight off. I'm 220 now. I usually work out at least 20 hours a week. Yesterday I did an hour of insanity workout in the morning, worked dogs all day. That's what I do for a living. And then in the afternoon I rode 20 miles. And being 50 years old and being able to do that day after day was impossible before.
Before I started the therapy, the hormonal therapy, I felt really bad. I had no energy. I felt like that time was getting away from me. The night sweats, the unhappy all the time. After the pellet hormonal therapy, I felt like I had a new life, huge impact on my life. I had the energy, I had the desire to go and enjoy life again, and I feel great.
BioTE Medical is a Texas-based company that has played a significant role in the development of subcutaneous testosterone pellet therapy for men and women. BioTE Medical hormone pellet therapy is the only method of hormone therapy that provides sustained hormone levels throughout the day for up to 4 to 6 months without any roller coaster effect.
The quality of practitioner that BioTE Medical is looking for could be an OB-GYN, could be a family practice doctor, general practitioner, even a cardiologist, someone that is interested in offering their patients an alternative to bad medicine. And what I mean by that is they're interested in fixing the problems and not just putting a Band-Aid on the symptom.
Bioidentical hormone replacement therapy, powered by BioTE, fueled for life. Experience the BioTE difference. Go to biotemedical.com.